All right. Good evening, everybody. My talk is going to be about a human-like robot that we're developing at the University of Pisa, together with Stella Maris, which is a research institute in Pisa. And we're developing this robot for what we call adaptive therapy in autism. And the reason why the title is Looking into the Face of Autism is because the face is the name of our robot. And the autistic child looks into the face of autism to understand himself and others. Well, I don't want to dwell too much on this slide because I think you all know what the characteristics of autism are. The two that we particularly wanted to address within our project were the ones in red. So they are known to prefer inanimate objects, for example, computers and toys rather than people. And they have difficulty in empathizing. So they have difficulty in understanding what other people are thinking. This is obviously a very common deficit. Before describing what we do, I'll just go through some of the therapeutic tools that are actually available in terms of software packages and robots. There are actually quite a few, and they've been successfully used for ASD. For example, the mind-reading software by Human Emotions. There are others as well. I can't remember their names at the moment. But basically, these therapies are based on learning how to cope with social situations and learning to look at people's emotions and put names to them. Also based on imitation. The problem with these software tools is that generalization is a problem, as we all know. Whereas on the other hand, it's been shown that at least in high-functioning autism children, when they interact real social scenarios in a family or in a therapeutic context, they can actually learn to generalize outside of the therapeutic context. The computer-based therapy has actually gone a lot further. For example, there is a kind of virtual reality therapy known as affective computing, which is very, very interactive. There are wireless toys, and there is interactive reinforcements, and a much more realistic kind of virtual computing environment. Going even further on, there's a system known as Auto Tutor, which is equipped with eye tracking equipment and body posture measurement. And so the system is actually able to recognize where the subject is looking and whether he's uncomfortable or not, and so work in a much more interactive manner. And these systems are all available, maybe not necessarily for autism therapy, but they soon will be. For example, I believe this one isn't actually available at the moment. Robots have also been proposed for therapy for cognitive disorders. There are several examples of robots, and in particular we focus our research on human-like robots, so robots which are capable of displaying emotion and have very realistic features. This type of robot is actually very common amongst the Japanese robotic community. You've probably seen them in the news, on the internet. They have these very beautiful robot dolls that smile and giggle at you. Now, before I go into my talk, I just want to introduce this uncanny valley hypothesis. It's a hypothesis put forward by a Japanese robotic researcher called Mori. And basically, he proposed, it's just a hypothesis, just a conjecture, but he proposed that our familiarity or our ease with a robotic instrument depends on how closely it resembles a human. So if you just look at, for example, okay, you just look at, for example, this dotted curve over here, and over here we have familiarity or ease with the robotic system, and on the x-axis we have how closely it resembles a human. And the closer we go to resembling a human, the more we like it, we get to a certain point where it's pretty human-like, like a humanoid robot, and then we suddenly have this dip where we don't like it because it becomes too human-like but not human-like enough. And he calls this uncanny valley. This is where it seems to be like a zombie and we don't like it. And then as we move along towards greater human likeness, we get to puppets and then a healthy person, which is obviously very, very familiar and we like it. I just talk about this because this has actually helped us, guided us a lot in developing our system, and it's actually helped us to. I'll explain it to you later. It's helped us to put autistic children on this diagram as well. Now, as I mentioned before, robots have been used for ASD therapy. And the reason why is that they seem to elicit attention much more effectively than a two-dimensional environment. That means a computer, okay, because they're three-dimensional. And as far as ASD and robotics are concerned, we can split the robots that have been used and reported in the literature into two groups. There are the robots that are toy-like, boxes with wheels or cars or dogs. And there are robots which are human-like, androids, so dolls, systems with two eyes and a mouth, okay? And in both cases, they treat autism or autistic disabilities, focusing on comprehension, communication, and enhancing social skills. So they basically focus on using the robot as a toy to interact with, okay? Now, I'll show you a couple of these very quickly. There's a robot system developed by Francois Michaud in Canada, and they use these colorful robotic toys, and in which they sort of focus on color and shape and attraction, movement, so that ASD children will follow them and look at them really closely. And they've had a lot of success with these. There is another system called, developed by Karen Doughtenham in the UK. And they have a couple of robots. One of them is called Robota, the other one's called Casper. And their aim is to encourage social play. So once again, they use their robots as toys rather than as emotional systems for learning emotion or empathy. Now, our hypothesis is slightly different. We think that if we can develop a robot with facial expressions that can be modulated and adapted to the patient's requirements, they'll be more easily acceptable to the patient. Rather than, for example, a human actor who has a high number of different expressions and a very highly complex output, our robot system can be tuned to have very, very simple and repeatable stereotypical expressions which are more easily assimilated by autistic children or autistic people in general. So rather than use them for social play, we think that a therapy in which the robot can actually adapt its behavior to the patient's requirements can help the subjects improve empathy, so they can learn to empathize simple expressions, and then we can increase the complexity of the expression to teach empathy to ASD children. And this is what we call adaptive therapy, because we adapt the expressions and the complexity of the expressions to the patient's severity of symptoms, for example. Okay? So we base our therapy on a stepwise protocol, in which the subject is guided to interpret and understand expressions, and we modulate the expressions in their intensity from one session to another as we go along. We've actually worked on this over the past 6 or 7 years, and as we developed our project, we learned a lot of things. Now, our first robot, the phase 1 robot, was actually pretty ugly. It had limited expressivity, very few degrees of freedom. It didn't have a lot of expressions. And we only tested it on one autistic child and one control subject. And what we noticed was that the control subject was afraid. She didn't like this robot at all. She was very uncomfortable. Whereas the autistic subject liked the robot, and he wanted to talk to her, and he said it was a fairy, although she looked a little bit sad. we then went to a group of artists. This was actually made by a local art school. So we went and found some more professional artists, and we had another robot which was much more aesthetically pleasing, and it had more degrees of freedom, so it could actually have more expressions. We tested this on 4 autistic subjects and 3 controls, and we found that it was better accepted both by the autistic children and also by the control subjects. And we've actually published this if you want to have a look at it. Oh dear, sorry. Oh, sorry. I have to figure this out. Okay. We published our findings. And what we noticed was that the autistic subjects were shown to increase their repertoire of imitation abilities and also to increase empathy. So they could actually very easily put names to what the robot was thinking and so on. Our current phase is now based on this robot here, which I'm going to show you in a minute. And it's a much more realistic robot. But going back to our previous studies, what we realized, or what we think we managed to figure, was that the uncanny valley graph moves for autistic children and normal children. So our first robot was not very acceptable to typically developing children, more acceptable to autistic children. The second robot was more or less acceptable to both. The third, a more sophisticated robot, which is the one you see on the top. Oops, oh, I'm sorry. I have to figure this out. Which is the pointer? It's the red one. The red one. Okay, sorry. This is our current robot, she's very realistic. And she's like, I've drawn her on the top here because what we think is that a real person may be a little bit less familiar for an autistic person. They don't want to look at the eyes of a real person. They feel uncomfortable. So we think, it's just a hypothesis, that if we're talking about ASD subjects, they'll be more at ease with a robot rather than with a real person, just because of the complexity of the emotions that the real person can express. Okay, just a hypothesis, but we do believe that our human-like face is more easily assimilated by autistic children. This is the current face that we've got. So it's a video. It's a robot developed by Hanson Robotics in the US, made of a silicon-like rubber skin, and it's got 32 motors. Sorry, this one here.